Good morning, everyone, and welcome to today's webinar, Walking in a Good Way with First Nations, Métis, and Inuit clients. My name is Andrea Bodkin, and I'm a Senior Program Specialist here at Public Health Ontario. And today I am coming to you from PHO's office in downtown Toronto on lands associated with the Toronto purchase of Treaty 13 territory. And I do also want to remind you that our Ontario Public Health Convention is coming up in just a couple of months, March 28th and April 2nd. And if you would like more information, you can go to tophc.ca for details. That's topic.ca. I'd now like to introduce my co-moderator for today's session, Sonia Strom. Sonia is the program manager for the Public Health Nursing Practice Research and Education Program, PHN Prep, at McMaster University School of Nursing. Sonia supports project management, research and knowledge translation, collaborating with public health nurses and managers in Ontario's Healthy Babies, Healthy Children, and Nurse Family Partnership programs. Over the last 18 months, Sonia has collaborated with the provincial team to develop nursing care plans and guidance for addressing perinatal mental health concerns among individuals in Ontario's home visitation program. Sonia, welcome.
Thank you, Andrea. Good morning, and to your team at PHO. I am thrilled to be here today, co-moderating with you and representing the work of the PHN Prep team in supporting public health nurses, supervisors, managers, and home visiting staff in their work with families. I would like to begin today by acknowledging my position as someone of settler colonial ancestry. I recognize that the land on which I live, work, and raise my family here in Brantford, Ontario, is full of rich Indigenous history, sitting on the traditional territories of the Anishinaabe, Haudenosaunee, and Neutral Nations, and home to many First Nation, Inuit, and Métis people today. I also acknowledge the deep and lasting impacts of colonialization, including the traumas, violence, and genocide that Indigenous people have endured and continue to face. Despite these injustices, Indigenous communities have shown immense strength, resilience, and generosity in their stewardship of the land, and it is with humility and a commitment to reconciliation that I honor their ongoing presence and leadership. And it is now my pleasure today to introduce the speaker of our presentation, Trista Hill. Trista Hill is a member of the Mohawk Nation and Wolf Clan from the Six Nations Reservation along the Grand River, so a neighbor of mine. She is a proud mother of 4 and recently celebrated her first wedding anniversary. A graduate of the Aboriginal Midwifery Training Program in 2017, she became the first Aboriginal midwife hired at the Southwest Ontario Aboriginal Health Access Centre, or SOHAC, in London. Trista is now based at the Southwest Ontario Aboriginal Health Access Centre office in Cambridge, Ontario. And I am pleased to now hand it over to Trista.
Good morning, everybody. As Sonia had said, my name is Trista Hill, and I'm from Six Nations. I am currently residing on Mississaugas of the Credit First Nation with my husband and 4 children. And I will be talking with you today for the webinar, Walking in a Good Way with First Nations, Métis, and Inuit clients. Could we have the next slide, please? And this is just a disclaimer. I was asked to put up for this presentation. We can have the next slide. And here's just a list of our webinar objectives. By the end of this session, participants will be able to describe the effects of intergenerational trauma and stigma on First Nations, Métis, and Inuit families, develop strategies and build confidence to engage in meaningful discussions with the families around mental health, and recognize the importance of cultural safety and its role in fostering trust and healing, incorporate holistic approaches such as the medicine wheel into practices supporting Indigenous families. Be able to use open-ended neutral questions to respectively learn about clients' experiences and perspectives. Next slide, please. So this is just a copy of the agenda. We're going to go through a bunch of different things that I put together, some slides on mental health and how it's understood among First Nations, Métis, and Inuit families. The two-eyed seeing framework and the medicine wheel as a holistic tool. Yeah, and providing obviously culturally safe and trauma-informed perinatal care to Indigenous clients. I will also give you some examples of some questions, how you can approach the topics in a safe way, that Indigenous families can be accepting of the questions, I guess. So I promise I'll try my very best to get through everything in a timely manner, and hopefully I won't have to rush through things. Next slide, please. So as Sonia said, she introduced me. I'm from Six Nations, and so during my training as a midwife, I've had many, many visits with our clients and community members, some of which, of course, were in hospital. Most of them were in their homes. And I've been told by people that I have a way of connecting with the clients very quickly. And I feel it's simply my approach at the visits. Let me see. Yeah, so I've worked alongside with public health nurses and with healthy children workers. And yeah, most of them were Indigenous practices. But I feel like sharing my experiences would be very beneficial for you. And I have also had some visits from, like as a client, so from non-Indigenous workers as well. My two youngest children were born in the hospital. So yeah, I've got a different lens from a couple of different perspectives. Next slide, please. So we're going to talk a little bit about the impacts of racism on mental health with First Nations, Métis, and Inuit families. So the ongoing trauma has had a severe impact on the mental health of Indigenous people of Canada. That's from Haskell and Randall, 2009. So I'm just going to give a couple of background on some key historical events in Canada. So like the residential schools or the 60s scoop, children were taken from their homes to residential schools and never returned. Others faced harsh conditions while attending residential schools, such as their nice long hair was cut off as soon as they arrived. Their bodies were scrubbed down using harsh cleaning chemicals. They were all given a number to use instead of their name. They weren't allowed to use their Indigenous languages, and they were beat if they didn't speak English. So, like, why would you ever want to use their Indigenous language coming home after experiencing that, right? So the list goes on and on of the things that the children were experiencing. Of course, not every child experienced this when they went to the residential schools. There's also the 60s scoop. So that began in the late 1950s to the 1980s, where children were literally taken or scooped up, thrown into like a bus or a van or whatever they were driving from their homes and communities and adopted out to white middle-class families. This is again where a number of traumatic events took place with the children. So you have intergenerational trauma. So Indigenous families didn't know how else to cope with a lot of things that they had experienced. So there was a lot of like alcoholism, substance abuse, suicide, sexual abuse, physical violence, disconnection with our own culture. So those are just some of the few outcomes from the different traumas experienced by the Indigenous peoples. There's epigenetics, which is trauma that can be inherited through epigenetics, which changes in DNA that alter gene expression. There's the missing and murdered Indigenous women. So I don't know if you are familiar with the hand over the face logo. The meaning behind that, I believe, is a red hand over the mouth has become the symbol of a growing movement, the Missing and Murdered Indigenous Women Movement. It stands for all the missing sisters whose voices were not heard. It stands for the silence of the media and law enforcement in the midst of this crisis. It stands for the oppression and subjugation of Native women who are now rising up to say, no more stolen sisters. So a lot of Indigenous community members, there's a big stigma around mental health. I think that's in general, but with Indigenous families, as soon as they hear the word social worker or family and children's services, any type of engagement with them, the first thing that comes to my mind, that comes to the mind, and that can be barrier to having conversation, is they think open file with FNCS or apprehension, or now we have to jump through hoops. I have encountered also some gay people or two-spirited people who are raising children who don't like to admit they are gay or two-spirited because it's very widely still unacceptable in a lot of communities. Next slide, please. So there's some resiliency factors here. Despite colonization, efforts to assimilate and ongoing racism affecting their lives, Indigenous people have shown great resilience, mainly through their connection to traditional lands and culture. So as public health nurse, healthy babies workers, I think it's really important to know where the resources are in the surrounding area for the clients or the families. So there's like, home and community care workers and their roles. My own personal experience, I had some issues after giving birth to my second born. And I was really very sore after, like my bones and everything. And they were actually going to get the home and community care workers to come in and like help me with like, say, lifting heavy things like with laundry and stuff like that. So that would have been a huge help for me. So another thing is like, say, pelvic floor physio. So that could be from having, like a traumatic birth. Is there counselors available or different virtual options that they can talk to somebody? Home visits are very, very helpful. Sometimes transportation can be a big barrier. I know at certain organizations, they call NIHB. NIHB is available to provide transportation to some of these appointments. Maybe there's bus passes available from some of these organizations. So again, it doesn't hurt to look around the community and see what kind of resources are available or what's offered for the Indigenous community. Some community agencies also do like good food boxes where there's fresh produce to be handed out as well, or like a gift card for food for the families who are in need. So yeah, some Indigenous organizations have this type of thing available for the families, which is really nice. I think it's just a matter of asking the proper channels and finding out who has what. Pregnant people are viewed as life givers. They're always taking care of. The other family members will come in and look after them, whether it's the mom or the auntie or the cousins or just like a really, really close friend of the family. And also when visiting, it's not just to see the baby, it's also to offer help in some capacity, whether you sweep the floor or do some laundry, or you bring, a big tray of food for the family. Holding baby while mom takes a shower and just freshens up, like that can make such a world of difference. So that's generally the rule in community is, everyone has like a role to play. You don't just come just to visit the baby and make mom or the rest of the family members entertain as a guest. So it's usually their time to rest, establish feeding, and heal. Usually, like we encourage as Indigenous midwives, we encourage the mom to be in bed for the first 10 days. They're just in bed, they're healing, they're establishing feeding. And it used to be 30 days of rest and healing, but society has changed so much. And I'm, for one, am glad that things have changed a lot where people can take up to 18 months from their jobs to be home with their families. You can miss out on so much by being away from your family for work. So that's just a really nice option. Okay, next slide, please. Okay, so we have two-eyed seeing. So two-eyed seeing blends Western evidence-based practices with Indigenous knowledge and lived experience. Thomas, a two-spirited person, suggests that focusing only on best practices is limiting, and we must make room for Indigenous wisdom, which is gained through shared stories, cultural insight, intuition, and learning from experience. This approach highlights the value of building relationships based on mutual cultural respect. It also combines scientific methods like epidemiology with storytelling, traditional Indigenous way of teaching and learning. And I, for one, am not like a professor and claim to be an expert on anything. I'm simply here just sharing my knowledge and my experience. Next slide, please. So the medicine wheel. This is used as a tool to support the integration of Indigenous and Western teachings and traditions. The way I practice is by using the medicine wheel teachings. I always check in with our clients on all 4 aspects of life. We don't often know where people are coming from or what they're going through. So it's always good to check in every which way. I always ask, how's your family doing? Family is so important, right? So by checking in with their family, I feel like that is like a really good way to kind of get the clients to let their guards down a little bit, oh, they're interested in my whole family, not just me or not just baby, etc. So once they start talking about, their children or their parents or their siblings, you just let them talk, you let them say what they need to say and engage with them. So that's a good way to encompass the whole like mental health as well, right? They'll tell you if something's bothering them, hopefully. They Once you connect with them on a certain level, I feel like that's a really good way for them to open up and tell you more. So helping them to realize that we're not just here to collect stats or making them feel like they're just a number to us or you're just there to tick off certain boxes, on the paper. They want to feel like we care as healthcare workers, saying things like, oh, I have a child myself. I understand how you could be feeling so tired like this. The most important thing right now is feeding your baby and yourself. Everything else can wait. That takes a huge weight off their shoulders. They don't feel like they have to do everything. Or you could say things like, oh, no need to apologize for the mess. I'm not here to judge. I'm here to visit you. Or rather, anybody with kids knows it can be challenging to keep a house spotless. So this just came to me earlier when I was washing my hair. But I remember always hearing that term when I was younger, the dirty Indians. I don't know if anyone else has heard this before, but it's probably from a movie or something. But that's something that really sticks with a lot of people. So like a lot of people I know, if they have dishes in their sink or if they haven't vacuumed their floors today, they don't want company over. They don't want anyone to see their house like that. They don't want people to see the dirty Indian, right? So that's why it can be challenging to get into the homes for a visit. Sometimes offering like an alternate place to meet them I know what I have done in the past is picked up my client and took her for a coffee and just chatted with her and touched base that way. Um, so again, that was like a really good treat for them, and they didn't have such an issue with opening up about what's going on. Next slide, please. Oh, so this is just a picture of the 4 sacred medicines: tobacco, sage, cedar, sweetgrass. We call it our sacred bundles. Every single one of them have their own job, so such as gratitude, kindness, or cleansing or protection. And it is totally okay if you're not knowledgeable about the medicine or smudging or any kind of ceremony. It's perfectly acceptable to let the client know this and just maybe offer a resource for them in the area to point them towards that could help them with this. They could be building their bundle. They might not even have one at all. Okay, next slide, please. Okay, so just a few tips for working with the Indigenous families. Maybe you can ask them how their birth went or how parenting is going. Maybe they have a toddler at home already and then just gave birth. Ask them how they feel in general and just being present and listening carefully. If you need to make notes, just, ask them if it's okay and let them know it's helping you to remember the important stuff. You jot something down here and there, that's usually perfectly acceptable. Versus coming in and having your clipboard ready and like asking, tick, 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 that kind of gets people a little maybe riled up or nervous. And that's when they kind of shut down and don't want to talk about things. If you notice a client gets upset, just allow them to pause on that topic and circle back to it later if that helps. And it does help, again, if you can speak from experience. Tell them a story, just let them feel like they're not alone. Next slide, please. Okay, so this is a picture of my beautiful little daughters. That's Ashley, the older one, and Oakley is the baby. They are now 5 and 2. So I just put that there because I wanted them in this presentation. So becoming a mother can trigger big feelings about someone's own childhood experiences. It can bring up, you know, we've had, so I've had women who never disclosed that they've been, say, sexually abused. During labor and birth, that comes out. If you're paying attention and you see the signs, that's something that kind of comes out. It's such a huge movement for your body to go through to give birth. And so that's something I always kind of know as a midwife, of course, to talk about with them later. That's why I think it's really important to let them talk about um, their their birth stories and becoming a mom. You want to talk about things like how they felt when they were in labor and how they felt after they had baby in the hospital, and maybe even asking them what their needs are right now as a postpartum. I feel like people that have grown up in foster care, they need a lot of encouragement and praise for all the great things they're doing now for their children. Again, we don't know where they're coming from, where they've been. So there also can be a lot of anxiety around parenting and feelings of inadequacy and or fear of judgment, going through IPV, whether it's current or in the past, traumatic childhood, previous abortions or miscarriages, issues with breastfeeding are all huge factors for postpartum depression. So that's just something to note. Next slide, please. Okay. Yeah, this is just asking the questions about mental health. So like a gentle approach. You want to let them know the reason that you're there and you're always asking for permission to continue to address the topic. Again, offering to meet them in an alternative space if they're not comfortable meeting in their own home. And if you need to complete some questionnaires while you're there, can you let them know that ahead of time? And you can even ask them if it's okay that you work through them together if they prefer, because you can't assume that somebody they always know how to read or write. Okay, and always ask if they have questions or if they understand what you're asking. Next slide, please. So having a difficult conversation. So again, please understand and or familiarize yourself with intergenerational trauma, and allow them to vent. If they start to vent, like just kind of follow them down the rabbit hole and let them talk. Keeping your poker face and knowing that clients tend to get more off their chest when they have like an understanding face. Don't, I feel like sharing a little bit with you so personally, I've been through counseling, and the things that I was telling my counselor, she just could not believe that, I could tell her things with a straight face. But that's kind of what we learn, is how to hide things. So, if you're engaged with the client and understanding, paying attention, listening, they get that. And when they get that, they will tell you more. Okay, next slide, please. So again, the super important piece here is knowing the services or resources that are available in the area. I realize life is much different now before baby was born. Let's figure out what we can do, one thing at a time so they don't feel overwhelmed. Let's set an ultimate goal, like an overall goal, but not too far ahead as to overwhelm them. And we can make a checklist, and each time we get one step closer to that goal. So those are kind of the ways that you can approach the different topics here. And then, celebrate with them, bring them, a little travel mug or something. You made it, you did it. We did all the things that we said we were going to do, and now we're here at your ultimate goal. Okay, next slide, please. So these next ones were taken from the Perinatal Services BC. It's a cross-cultural dialogue framework taken, like I said, from Perinatal Services BC. The next few slides will elaborate on them. They do go and coincide with the way Indigenous healthcare workers do their thing, at least the ones that I have personally worked with. So you got respect, relevance, reciprocity, and responsibility. Next slide, please. So you have there the 6 practice principles. It really is the way that we all practice. Like I feel like, I don't know if you've heard of the 2-row wampum, where like there's the Western side and the Indigenous side, and everyone kind of travels along beside each other. We all have the same goal. We just have slightly different ways of getting there. So I feel like this pertains to all of that. Next slide, please. Okay, cultural safety and cultural humility. Things that you can do as healthcare providers is to let the clients know they're welcome to ask as many questions as are needed to feel comfortable, supported, and safe. And asking whether they feel safe in your care, and if not, what you can do to help them feel safe. So I've got, I had a little bit of issues with some of the people that I had in my healthcare at a hospital. I felt like as soon as they knew I was a midwife, they felt like they didn't know how to like look after me, because I should have known everything. So, I didn't feel like I was well taken care of, because because of the fact that I should know better or I should know the answer to all these things, which, isn't true. So just, being welcoming and asking the clients if they have any questions or like if there's anything else that they need, that can go a long way. Next slide, please. So self-determination, that's pretty straightforward. Next slide. And again, see, this is the same thing, you ask your client how they're doing. You want to listen and respond in a way that acknowledges you, understand, how they're feeling. You may choose to share your own story and or experiences. And another thing I wanted to point out is that if you don't have like children of your own, that's okay. You might know somebody, or you can use a story, that you've heard along the way, just again, relating to them on some level, whether it's through your own experience or not. That's really important. Next slide, please. So that respect. So if you can adopt a universal approach that assumes everyone has experiences of trauma, which is likely true, everyone has their own baggage. I always say that. And being non-judgmental, and being understanding of where people are coming from. And this is probably the golden rule: treat people as you would like to be treated. You want to you don't want to treat people in a negative way. You don't want to cut them off when they're talking. You want to be heard. So you want to give that same respect to other people as well. Ask respectfully about traditional practices and whether clients would like to access support. And again, I know it's very repetitive, but just knowing where all the resources are in the community, what's available for them. That's very important. Next slide, please. So again, if you can engage in ongoing training around, Indigenous communities and history, and do some self-reflection, that's really a good point. Just understanding the social determinants of health, determinants of health, sorry. Practice cultural humility, advocate for systemic change, collaborate with communities. So those are all things that you can do. I know a lot of agencies in the area are usually very open to collaborating with you. So all it takes is reaching out and talking to them, letting them know what you're looking for. Okay. Can we have the next slide, please? Strengths. Okay. So yeah, again, focusing on strengths and resources of Indigenous clients, right? Everyone has strengths. Provide care that places focus on clients' positive experiences and that supports their informed decisions. Next slide, please. Okay, so sometimes as parents, we suffer in silence. Sometimes we suffer a lot longer than we normally would have if someone had just gave us a bit of praise around us. Gave us some directions where we could have gotten help when we really needed it. Remember, Indigenous parents have a very hard time asking for help as well. Sometimes just a family member or Healthy Babies, Healthy Children worker can be like sitting with baby when mom catches a 15-minute shower, makes a world of difference. Playing with the toddler while the parent gives baby a bath, huge help. I think even the tiniest praise goes a long way. Example, mom has been struggling with pumping breast milk for whatever reason. This mom finally pumps 4 ounces in a day. Give her praise. A mom goes to the grocery store with her toddler and newborn. and comes home with groceries, that's a huge win. So like I said, we never know the true depth of someone's thoughts and or how quickly they can become consumed by them. But these tiny compliments or gestures can make a difference between having a great day or an overwhelming, overstimulated, crying in front of the TV all day kind of day. Alrighty, so just remind the clients that they're doing a good job. And next slide, please. So thank you so much for listening. And yeah, I'm going to pass the mic over to Sonia.
Trista, thank you again for your presentation. If you want to come back on camera with me, we will now move into the question and answer period. So thank you so much for your presentation. Our PHN prep team has been working over the past 18 months to develop a nursing care plan and practice guidance for assessing and responding to perinatal mental health concerns among pregnant and postpartum individuals who are clients in the Healthy Babies, Healthy Children program. And I've talked to you a lot about that in preparing for today. And I think, there's a lot of alignment between the way you presented some of your information in terms of how you would approach, not immediately necessarily jumping into assessment, but more having conversations and figuring out how people are doing, asking them questions like how is it going? How are you feeling? That really sort of align with what we also included in the care plans. And we really emphasize in those care plans, the public health nurse really looking for signs, symptoms, risk factors, and protective factors when they're engaging with families. And so I just wondered if you might speak to what would be, knowing that symptoms might be expressed differently by different cultures, like what might be some of the things that a public health nurse might look for that might be different among Indigenous clients that they might be working with?
So I think that a definite watching their body language is a huge one. Listening to their words. I found that has become a really great tool. They can be so subtle, right? Those little, like I call them red flags, you kind of watch for the way, like say they say something like, but nobody cares about that. We'll just keep talking about this. You know what I mean? That's something that you just need to learn to watch for and listen, and circling back to that. You want to be able to circle back to that later in the conversation. So yeah, definite body language and those little keywords you want to watch for.
Thanks, Trista. We did have one person ask, what is IPV? That stands for intimate partner violence.
Yes.
So thank you for that question. We have a question from, she says, hi, Trista, Miigwech, I hope I'm pronouncing that correctly, for this amazing presentation. I was wondering if you've heard about the Pregnancy and Infant Loss Network and the supports they have for Indigenous families.
I have heard of them. I haven't engaged a whole lot with them, only because I had only heard of them when I got back from my mat leave. So I haven't heard anything Indigenous specific regarding their program. But yeah, that is something that would be worth looking into.
We have another question. You mentioned a lot about sharing your own experiences. A lot of times in nursing practice, we are discouraged to self-disclose personal experiences. How do you balance this so that you don't negatively affect the therapeutic relationship?
So this is interesting to me because I do know that is something that is discouraged, is, like communicating on that such personal level. I feel like it's still okay to share a bit, whether you just use it as like an example of someone else. You don't have to say that it was yourself personally. You could say, again, that it was, your auntie, or like you heard of a friend who did, like, went through such and such a time. Because again, there's got to be a way to connect with them on that level, because I feel like that kind of helps them to not look at you so much as way up here looking down on them. You know what I mean? It brings it down to where they're like, wow, you're human just like me. You know what I mean? And we're all human. We all go through things. And yeah, I think that's where I'm at with that.
Thanks, Trista. And I recognize too that that was a piece of advice specifically laid out in that Perinatal Services BC resource that you shared. And that I can also get a reference for that resource, but it will also be in the slides. And that did sort of stand out to me too, but I think that just emphasizes the importance of sharing of experiences and storytelling among Indigenous cultures, maybe.
So if I could just add that that is definitely how Indigenous people connect, is through storytelling. So like that's huge. If you can, if you can even bring up like something that you read on the internet where this happened to such and such a person, you know what I mean? So it's just, again, just relating in some way, shape, or form.
Just general comments saying great presentation, very informative. With respect to the medicine wheel, so a question about that. I don't really understand spirituality. Could you please speak to how you address and support spirituality with your clients?
So I think across the board, it's really important to acknowledge that people all have a different way of doing things. And you don't have to be specific to anything when you're talking about spirituality or whatnot. You can, like the way that I bring things up with clients is, I don't know what your thing is. If you have a thing where you might pray, you might smudge, you might do ceremony, you might go to church, like everything is different it's different for every family, and that's okay. But if there is something that you would like to do or would like to connect with, I can help point you in the right direction to get you help with that.
Thank you. Yeah, I think spirituality doesn't necessarily have to align with a religious belief, right? It's a much sort of bigger concept than that. I love the way that you described asking about that. Thank you, Joanne, for that question. Someone asked here, what are some strategies for overcoming potential barriers to building trust with Indigenous families when you're discussing sensitive topics like mental health and things like infection control practices to protect themselves and their families? So strategies for overcoming those barriers.
That's a big question. I would have to think about that one. That's a big question for me, I think. So the first part, can you repeat the first part again?
Sure. So they're asking for what are strategies when you're working with or you're working at building trust with Indigenous families, but you have to discuss sensitive topics like mental health or infection control practices. What are some strategies that you can use for overcoming the barriers to building trust when having those sensitive conversations?
So I think like a really important thing is always just being, you got to be transparent. I think that's the biggest thing, when you go in and you tell them the reason for your visit, I'm here to visit with you. I'm not here to like check in and like check up on you. And also being straightforward and letting them know that, we can have these conversations and I can listen and I can try to point you in the right direction or offer resources. But I also have a duty to report, right? So like if I hear something that could be affecting anyone in the house's safety, that kind of thing, like I do have a duty to report. And if things like that come up, like letting them know, like I might have to make a call to so and so, but we can figure out a plan in the meantime to kind of help alleviate like some of the whatever's going on, right? I think that's really important. I hope that answers the question.
I think transparency is essentially what you're describing. I think you've also throughout your presentation really kind of emphasized sort of just general curiosity and care. And we talked about that when you and I were kind of meeting ahead of today's presentation is the reason why I'm asking these questions is because I've noticed, or the reason why I'd like to ask you some of these questions is because I care about you, and I noticed that, so we're demonstrating the place where it's coming from. Thank you. Okay, so this next question comes from Susan Jack. Thank you, Trista, for sharing your wisdom and expertise with us. In public health nursing, nurses often use structured assessments. So you're familiar with the tools such as the EPDS, the Edinburgh, and the General Anxiety Disorder 7 tool, where nurses ask really structured questions to help assess and determine if a mom might have signs or symptoms of perinatal depression or anxiety. Do you have any tips on how a nurse can best explain to a mom why they're asking these questions about mental health?
I love that question. So yeah, so say I'm in a visit. Usually, again, we check in with them, how they're doing overall, everything, what's going on. Are there any stressors going on? Do you feel a bit bluesy? That's the first part to the question. And that's perfectly normal. Or, oh, that sounds a little bit much. Like, do you mind if we do this questionnaire to see where you're at? It gives you a score, and based on the score, we can figure out a plan from there, what we're going to be able to help you, how we're going to be able to help you. And again, you offer those resources. There could be um, like the virtual counseling option available. There could be a peer support group, like a mom to mom group. There could, like that will help them to kind of troubleshoot with other parents. And just, you know, if they're into like smudging or whatever, like you offer, oh, so and so has stuff to be able to smudge with. Would you be interested in that? I could, send you the number to call her, or I can have her call you if that's okay. Um, so I think that they're more open that way when you kind of, again, address the topic gently. You want to start out down here. You don't want to start out and say, okay, we have a questionnaire that's going to address to see if you have postpartum depression, right? So you just start out gently down here, and then if there's again those red flags, then you want to address that and say, oh, you mentioned this. Are you sure that's what you meant? Um, it will give you a score, like just explaining again and being transparent.
Thanks, Trista. And again, I think in reflecting on our process of developing the nursing care pathways, we really did try to emphasize that validation and normalization of what they were experiencing. And also when things started to be, become to the point where you may need to pull out an assessment tool, explaining that, the reason why, exactly like you were saying, like that what you said maybe concerns me a little bit. Is it okay if I ask you some further questions, and that this is why, and introducing it in that way. Thank you for sharing that. And thank you for sharing some of those ideas of then working with families and the goal setting that you would do. As a question, is there a best way to ask a client if they are involved in cultural practices? She has a young client and would like to share resources if she's interesting, for example, around smudging, but wants to know the best way to ask them if they're involved in that type of thing.
That can totally be just a straight up question. Like, is there anything that you practice culturally? It's very simple. There's no stigma to it, right? So it's a perfectly legitimate question.
Excellent. Thank you. As a question, first of all, she says, thank you for the informative presentation. She just completed a course for healthcare providers who are caring for Indigenous families, and the presentation helped by giving clinic examples. Has a question, can you also share with us sharing of resources verbally through storytelling versus written resources?
I don't know if I understand the question.
I'm thinking she's asked, is there a difference around sharing of resources verbally through storytelling versus written resources?
No. Well, kind of, I guess I'm going off the comment that I had made about like not assuming that people can read or write. So it's always nice to share the stories, and then ask them if if they want the resources. Do you want this link, or do you want me to write it down for you and you can take it and, because they can copy it and type it into the computer or whatever, right? I think that's, yeah.
Yeah, thanks for bringing up that point. He has another comment and question. So thank you so much for sharing your experiences today, Trista. Wonderful and insightful reminders about how to provide care for both Indigenous clients and all clients, really. She loved the suggestions for the use of self to connect and establish trust, and says sometimes we as providers can hesitate to do this for many reasons. As someone who doesn't interact directly with clients, but visits with First Nation, Métis, and Inuit peoples, what are some actions I can do to show support for these communities, especially when it can be difficult to recognize those who need reassurance as a stranger and an outsider?
Sorry, I got distracted here. Can you read that
I
again?
know they're wordy. When you're just listening, right? So as someone who doesn't necessarily interact directly with clients, but visits, what are some actions I can do to show support for these communities, wanting that reassurance as a stranger or outsider?
Okay. So again, if you're just visiting to like observe or whatever, just making sure your presence is known, that they know what you're there for. And I think just, if there's, you notice like, I don't know, something out of place in the home, like, do you mind if I just move this over here? Like, that's okay. It's perfectly okay to do things like that. And like, if you think of something that um you could help them with the outside resource, you can always chime in on a visit and be like, oh, hey, sorry to, interrupt, but I do know that there's a place down the street that does this or that or the other thing. Do you want to know what it's called? Or, that's perfectly acceptable to do that. I think that's what they're asking. I hope.
And I think it kind of goes back maybe to the questions other people have asked, like, how do I ask or how do I inquire? And your answers so far have sort of implied that you can ask directly with a genuine curiosity, and that's acceptable to Indigenous people to want that people want to know and understand more.
Yeah, definitely.
Ask, thank you for this. I work in sexual health providing services for clients. Do you know if there's any work being done to ensure that sexual and reproductive health care services are guided in a way that is appropriate for all populations?
I can't think of what it's called, but there is. Um, I know there's a clinic, I believe in Kitchener, that, like, I know myself, when I know of a client that has issues, say with a male person doing procedures on them, I'll attend with them, and I'll make sure everything's explained. I'll make sure, or try to help them get like a female if that's what they're looking for. There's nothing wrong with advocating and, helping them be comfortable. You want them to be comfortable, right? And again, you don't know what people have been through, or what they're experiencing at the time. Um, but yeah, I believe there is, and that was a good question.
Talking about and addressing perinatal mental health concerns can be difficult for many new mothers or parents. And there may be additional barriers that an Indigenous mom may experience in sharing her experiences of mental health with a non-Indigenous nurse. So do you have any tips on how a non-Indigenous nurse can work to create a relationship where the mother experiences more cultural safety and perhaps then has more trust to share?
No, I really think that as long as that respect is there, and, not, it's just, again, a way the topics are approached, and just being helpful. If they have somebody that comes in, it doesn't matter who they are, they come in and they want to help. They genuinely want to help them, and they care about what they're going through. And again, like just asking them, how do you feel? Is it okay if I show you how to wrap your baby? You know, is it okay if I get you an ice pack? Like, do you think this could help? So just being helpful, that's totally gonna open doors. Like if they feel cared for and respected, they're gonna accept help, and they're gonna connect.
Can you also share how we can incorporate parenting in the Indigenous community versus the Western model? Or you could talk to, I mean, you talked a lot in your presentation about when it comes to parenting and some of the concerns that Indigenous people might have, you know, given the historical traumas
Yeah.
and with family and children's services and whatnot. I'm not exactly sure what the question is asking, but
Yeah, I think another thing is again being resourceful and knowing that there's positive parenting groups out there. There are indigenized ones in the community, specifically Six Nations. Um, so yeah, some people do offer that, and again, allowing them to reflect on what kind of things you want to instill in your children. You know, getting them to reflect back to their own childhood and what they want and don't want for their children.
Thanks, Trista. Where do you see gaps in resources that could be useful for you or your patients?
Honestly, I just think there are so many resources out there that they're not being shared. Like or like people don't know, like say the hospitals don't know that this exists in the community. They just don't even they're not even aware. And I can attest to that because being a midwife in Cambridge, there's a lot of people that don't even know that I'm there.
Yeah. Thank you. I know we're getting close to the time running out. Regarding the 4 sacred medicines, which medicines correspond to which job? Which is for gratitude, kindness, etc.? Do you know
I
off the top of your head?
No, I don't. But I believe the way that I laid it out, it follows like starting from the top right quadrant all the way around. Um, it corresponds to the way that I written it in the bottom.
Right. Okay, great. So someone can reference the slides afterwards. Thank you. Any suggestions for a male delivering parenting programs?
Oh, just being understanding of where everyone's coming from. And it's not always about just the mom as well. It's about the whole family. It's about the it's about each partner, and it's about the whole family.
Thanks, Trista. Someone just wants to know what smudging is. Maybe we can quickly answer that before we have to go off.
So smudging is usually the burning of one of the medicines or all or some of the medicines. And again, they each have their job. What you do is you smolder it usually in like a shell, and you just cleanse yourself with the smoke. That's what it is.
Great, thanks, Trista. And I'm recognizing now that we're at time. If I want to be able to read more of these questions, and hopefully Trista and myself can look through the questions, and maybe we can figure out a way to be able to respond to some more of these. But in the meantime, I would just like to wrap up today's webinar by thanking Trista Hill for presenting. I would also like to thank Andrea Bodkin for co-moderating with me. And of course, a special thank you to everyone who joined us for today's webinar. Our next PHN Prep event will be on February 12th, so please stay tuned. The registration will be opening soon. Thank you and have a wonderful day.